Very rare but serious pathology, which is complex, debilitating, and often difficult to treat. The treatment is prolonged, it's costly, and unfortunately not always successful. An osteoarticular infection, when it involves the spine, it becomes very complex. It can be multifaceted in forms of spondylitis, spondylodiscitis, arthritis, epidural abscess. It requires urgent diagnosis and treatment. The most common pathogens still remain Staphylococcus aureus, Streptococci, and Mycobacterium tuberculosis. So this is the early classification, which is based on the anatomical focus and etiological focus. The first one is the tuberculous spondylitis or Pott's disease. It's caused by Mycobacterium tuberculosis. The course of the illness is slow but progressive. Key characteristics is anterior vertebral body destruction, but relative disc sparing in the early stages of the illness. There, it progresses with severe kyphotic deformities and cold abscess formation. Historically, this is the most recognized form. The next one is the pyogenic spondylitis, which is non-specific spondylitis. It's caused by bacteria, most common Staphylococcus aureus. It progresses acute, aggressive. It originates at the vertebral end plate and causes rapid disc destruction with forming of spondylodiscitis. It also includes all non-specific bacterial infections. The third ones are fungal and parasitic infections like Candida, Aspergillus, and parasites Echinococcus, but they are rare, typically in immunocompromised hosts and endemic to specific geographical regions. The next one is solely the anatomical classifications. Again, the vertebral osteomyelitis or spondylitis, confined to the vertebral body, discitis to the intervertebral disc. Spondylodiscitis, it's the most common in adults, which involves the disc and the two adjacent vertebral end plates. The next one is the spinal epidural abscess, which is an emergent situation, or even subdural or intramedullary abscess. This one is the modern era classification with 4 stages. Stage 1 is characterized with back pain and localized tenderness. It's very difficult to be diagnosed, but it's best if it's done, and the prognosis for the patient is for full recovery. Stage 2 is characterized with radicular pain or nerve root involvement. Stage 3, motor or sensory deficits or both. It's a sign of spinal compromise, of compression, and unfortunately, stage 4 is with paralysis and bladder bowl dysfunction, often irreversible. Those are again descriptive models based on the pathogen type, which helps determine the antibiotic therapy. Anatomical, which anatomical extent of the disease seen on MRI, and clinical staging, again based on the neurological status. The next one is the POLO classification, which is clinical radiological classifications with 3 types of patients. Type A patients are shown for conservative therapy with antibiotics and immobilization. There is no segmental instability, no epidural abscess, and no neurological impairment. Type B patients are shown for surgical stabilization, and type C patients, surgical stabilization often with decompression. The next one is the spinal instability score. The higher the score for cervical spine, also on the bone destruction, scored on the extent of bone loss, the segmental sagittal alignment. If there is hyperkyphosis, higher the score for more severe deformities, and also posterior element involvement, whether it affects the stabilizing structures like pedicles and facets. The next one is the SPONDIT score, which is based on C-reactive protein, pain based on the numeric rating scale from 1 to 10, and MRI findings. There are mild, moderate, and severe patients. Again, based on the etiological agent, neurological compromise, and segmental instability. But this time also abscess development and the failure of conservative treatment. The prescriptive outcome, decompression, the goal is to relieve the pressure on the neurological structures. stabilization to restore the spinal integrity and load-bearing capacity of the spine. If there is a large or expanding abscess, debridement and drainage, removing infected tissue and pus, and also stabilization. The last one would be the AO spinal infection classification framework. It's based on 4 categories. The first one is the anatomical extent, P for focal, M multisegmental, and C for compression. The next one is the neurological status, N0 for intact, and 3 complete deficit shown for urgent surgical intervention. The third one is the stability, S1 is stable, S2 potentially unstable, S3 unstable patients. And last but not least is the host, H1 for healthy hosts, H2 for immunocompromised hosts, but with chronic diseases like diabetes or chronic kidney diseases, and H3 for severely compromised hosts. Thank you for your attention.